Greetings, this is the coronavirus COVID-19 update for 3/24/2020. And we start out with the Baidu numbers. Baidu is a Chinese search engine, and they're showing us a cumulative diagnosis of 81,846, up 99 from yesterday, which is a pretty big number for China because they've just about eliminated the coronavirus. Overseas input, that's plus 47, and cumulative deaths, only 4 deaths over yesterday, which is a very, very small number. And then if you scroll down on the same page, you see a map of China, which is all of these provinces are turning lighter. This map used to be used to show the spread of the virus on the upper right, and all the provinces were turning darker and darker. Now what they're doing is taking each province and the number of cases minus the number of recovered cases and minus the number of deaths to show how many people in the province actually have coronavirus. And as you can see by the scale, the legend on the bottom left, there's a lot of provinces that are in the 1 to 9 case category and some in the 0. So they're really getting down there. Then if you scroll down, you see graph number 1. You can see here the total number of new diagnoses, 99, from overseas, 47. And this graph number 2, is not useful anymore because the national number and the Hubei province number and the non-Hubei are all pretty similar graphs, pretty similar lines. And in here they show a graph that they started maybe 2 weeks ago now, domestic cases and foreign cases. So foreign cases up 39,681 and China up 99. Then if you scroll down further, you see a list of provinces and the number of new diagnosed cases per province. You can see Guangdong has 5. Guangdong is a huge province. It's the most populated province in China with 2 big super cities, Guangzhou and Shenzhen. In Beijing, 5 cases. Shanghai, 19 cases. That's kind of been sneaking up there lately. In Hong Kong, 30, and Taiwan, 21. I don't know why that's written out. It happens sometimes. So Taiwan and Hong Kong were recently added here, and they're not added into the global tracker that we use from Johns Hopkins University. So there's always going to be a difference in the number of total cases now because China is including Hong Kong and Taiwan. Here's the global tracker by a research institute at Johns Hopkins University, the Center for System Science and Engineering. Total number of cases worldwide, about 418,000, 18,615 deaths, 107,000 recovered, and the vast majority of that would be in China. So this is the same slide, but I've been keeping track of these deaths. I'm not going to do this by habit, but you can see several days ago Italy had 4,032 deaths, and that was like an increase of 600 some over the day before. Then they set a global record here with 825 or 4825, up 793 deaths, which is still a record for any country. It's just getting ridiculous how many deaths Italy is having here. Then 5,400, then it went to 6,077, and then today 6,820. So 750 more deaths today. That's a huge number. It's down from their world record, but it's still a really, really big number for a number of deaths in one day. It's crazy big. Then outside of China, we have certain countries that are just really big clusters. Italy, USA, Spain, Germany, France, Iran, and South Korea. So we'll take a look at these countries, see what's happening. So I start out with South Korea because that's the most important country on the planet. The graph on the upper left shows South Korea. This is a graph I made, so I cut the data off at 3.6. Could have cut it off at maybe 3.2, just to show you how much, how crazy things were going in South Korea at the time. Other countries were leaping up thousands or hundreds of cases a day, like Italy, the blue line, the medium blue line, and Iran, the gray line. But South Korea, things were just going crazy. They were going up. They were jumping up 1,000 cases a day, which is way beyond what anyone else was doing. So this just shows you how bad it looked, back in early March. Then if you take a look at the graph on the right, you can see that South Korea has just leveled off. This is going up through today. And also that Italy is way above them now, and the United States is really accelerating more than any other country right now, the dark blue line. So South Korea really got it together, attacked this thing, did everything right, copied some things off of China, and they're the model country now. So if you want to see what South Korea did right, you can pause the screen or pause the video and read these headlines here. This is some of the stuff that Korea did right, South Korea. And there's another video that I made just on South Korea, so I'm not going to spend too much time on this slide. So this is Italy, which has been the epicenter. It won't be for long because the United States will pass Italy in probably 2 more days. Upper left screen, which these smaller screens are taken from a couple days ago or yesterday. So you can see the top one on the left, 651 victims today, and it was 793 yesterday. Well, they're still pumping out really huge numbers in the number of deaths. And another article from yesterday, why is Italy's coronavirus fatality rate so high? It's probably not higher than any other country. The reason that it is high is because they're not testing the general public. They're testing people only with extreme symptoms. So that's why the fatality rate is high, like 9%. But it would be, down to like, 3% if they tested the whole public. They're just not doing that yet. That's one really big problem in Italy, is not doing enough testing. And that's the same problem that the United States is having. The upper right, changes to the factory's decree are coming. So that's, if you look at the screen on the lower left, where a girl is holding up an Italian flag mask, there's a list of corporations that are allowed to remain open, and every other corporation and business is supposed to close. Whether they're going to have some changes to that, adding some more corporations that can be open. And then the other small screen beside that to the left is where these army trucks came into this small town in Lombardy province to pick up bodies to take them out of town to burn, because they were just piling up at the cemetery. The cemetery was full. There's no place to put these people. Really sad story. And then the bottom middle screen is what funerals look like now. They're all viewed on Facebook, basically. Both the ceremony in the funeral parlor and the burial in cemeteries are done on Facebook. And the screen on the right, Prime Minister fined from 400 to 3,000 euros for violations of being out. So that's another issue that Italy is having, is people are still wandering around, and they're going to put a stop to that. A lot of countries are having the same problem. And next we have stories out of Spain. The screens on the left are a little smaller. They're from yesterday or the day before. Bottom left, you have an exhibition center turning into a hospital. So that's good news. They're getting, more hospital. Hopefully they'll get some people to, man those hospitals, some medical people. Spanish minister says older people found dead and abandoned in basically retirement homes, rest homes, and that was kind of a shock. The army went in there and found these people. Growing support for sealing off regions in Spain. They're thinking about doing that. News stories from today. Madrid converts a city ice rink into a morgue. And that's unfortunate, but you have to have a morgue. Spain's coronavirus death total jumps 514 in 24 hours. Then we have Germany. Upper left is why is the death rate so low in Germany? Well, they're comparing it with Italy. That's why it's low. So it's not really low. It's in line with most other countries, and the United States is way lower. Care crisis. They're worried about after Easter, up to 200,000 nursing staff from Eastern Europe could be missing. Why? Because a lot of them will go home for Easter. People from Eastern Europe, being working in these medical centers and elderly care facilities, and they're afraid that when they go home, they're not going to come back to Germany. That's out of the Spiegel, which is German for the Mirror. On the bottom right, the World news from there is astronomical case increase in New York. It's really hard to find articles that pertain to Germany when you're looking at these German news sites. And from yesterday, the South Korean model is at Germany's rescue. It should be. You should follow what they're doing. And this is news out of Iran, and the news out of Iran is just all craziness. You can pause the screen and read these articles if you want. It's you either get no news out of Iran, or you go to Iran to the Tehran Times and get propaganda. Except for sometimes Al Jazeera does a really good article on Iran, but I didn't find one today. So the valid piece of news information coming out of there may be 1,762 new cases, but that seems like it's pretty low. And then we go to France. News today out of France. Scientific advisors are saying that 6 weeks of lockdown are needed, and that's kind of what they were hinting at yesterday. Upper right is they're talking about the Hubei province in China being basically, this is a very poorly written headline here. Headline on virus hit Hubei is eased. The part that I highlighted is actually the only valid part of this headline. As China's new coronavirus infections double. Well, that's not quite true. They're going up in some cities, and if they're doubling, it's like from 6 cases to 12. So that's very, very misleading, very poorly written. France's coronavirus death total tops 1,000. Lockdown will likely be extended. And then you can see the screen next to that where there's a lady in a car getting a swab for a test. She's actually a doctor. The only people being tested in France now are doctors and people that have symptoms. So they're not testing anybody either. They're not testing the general public. Then we have the U.S. The U.S. is basically a train wreck. It's out of control. Cases up 12,000 today, which is a new record, a world record for increases in one day. It's such a huge number. It's crazy. And why? You can pause this screen and take a look at your state if you like. The big epicenters in the United States now are Washington, the state of Washington on the left. From 1997 to 2221, that's not a very bad increase, but there's real big concerns about people walking around in Seattle now that the weather is better. And there were films yesterday in the news about, Seattle people just gathering together in big swarms, not paying any attention to any kind of, distancing. And then there's California, 2076 yesterday to 2267. It's amazing that California is not going crazy. It's kind of under control now, so we can hope it stays that way. Then the big epicenter is New York, from 20,875 cases to 25,665 today. And that's the state of New York. But the city of New York, we'll take a look at in a minute. And then the other epicenter basically is New Jersey, from 2844 yesterday to 2844 today. It looks like that number was not updated. So these are the numbers that I just discussed, except for in the top in the yellow, where cases from 43,963 to 55,000. That's that 12,000 increase, actually about 11,000 increase. And total number of deaths at 796. We're really getting up there in the number of deaths. Total recovered is among the lowest in the world. That's crazy, crazy low number. In and out of Washington, we'll go over the news stories on each one of these 4 hotspots. So yesterday they reported they had 1 death at a rest home, which is a new one. It's not the one in Kirkland where like 40 people died. And the big news, out of Washington, the lower left 2 screenshots are the vaccine was started on Monday, a week ago. So we'll see how that goes. It's supposed to last maybe 6 weeks. It might be accelerated a little bit. In the top, the state's stay-at-home order to limit COVID spurs confusion and anxiety. Well, he had to give the stay-at-home order because individual cities weren't doing it very fast. There's a screen print on the left where it had a list of cities in the state of Washington that were issuing stay-at-home orders, and there's just like maybe 4 or 5 cities. So, and then on the right, statewide coronavirus death hits 123, confirmed cases top 2,400. So we showed 2221. This was a newer article. Then we go to California. California, the news, from a couple days ago, this 34-year-old person died, kind of a young person. And then Sacramento starts doing drive-through testing, and that's by appointment. So, you have to have an appointment, but you can be anybody. Anybody that wants to have a test has to just go online and fill out this form and make an appointment, and then they can drive up in their car and get a test. And then you see California, the National Guard showed up and they're starting to help out. And then I have the last 2 days of screen prints from a map of California that shows you how many cases they have per county. And you can see Los Angeles County went from 536 to 665. And then in the San Francisco Bay Area, I don't know the name of this county, but it's where San Jose is. And it went from 221 to 275. Or I'm sorry, 321 to 375. Okay, New York. New York is a total disaster. You can see the number on the upper left, 25,665 cases, up 5,000 almost from the day before, and half of the U.S. total almost. And that's the state of New York. That's one thing when you read things about New York, you never know what they're including in the numbers. But I think that's just the state, because I got it from a state map. That doesn't include the Tri-County area, the New York metro area, which is something you never hear. You only hear of Tri-County area, which would be the, greater New York area population, 19 million. So Cuomo on the bottom left warning young people because a young person, 34-year-old, died in California. And because a lot of young people are coming down with coronavirus, testing positive. There's kind of been a battle going on between the mayor and the governor, and a real battle going on because the governor, sees all these numbers coming out of New York City and says, "What the hell's going on?" I see people. The picture below there. The small picture to the right of the U.S. shows a bunch of people in Central Park, just out walking around. They're not doing any social distancing. They're just, there's just big crowds of people everywhere. So the governor kind of gave a mandate to Cuomo that says, get it together and get a plan together. Deaths across 192 in New York. NYU offers medical students early graduation. NYU is a fairly decent size university, but it's not big if you're in the Big Ten or California or something, Pac-10. But I don't know how big their medical school is. I would think at most that would put 200 people, out there. But, it's better to have the National Guard medical people. And you can see National Guard people working on putting cots together in that one small picture. Also, what they're doing, and that picture is in Javits Center, one of these 4 locations for a temporary hospital. And then it says news from today. Another piece of news says New York becomes a bullet train with the ominous peak just 2 weeks away. People are predicting that it'll peak in the United States 2 weeks from now, and New York's already out of control. And on the right, I have 2 maps of New York State. And again, there's really no information on the tri-state area, because most things like Johns Hopkins, they accumulate their numbers in states now, and then they break that down by county. So you're not going to see, the real tri-state area in New York is New York City with all of Long Island, the coastal part of New Jersey, and the southwestern few counties in Connecticut. So the tri-state would be Connecticut, New Jersey, and New York. But it's a very small part of all 3 of those states. So on the right, there's an interactive map of New York City. You have to just rest your cursor on it to get the numbers, though. And it seems like all the areas are growing, in a proportional rate to each other, like Long Island and New York City. Okay, this is New Jersey, and New Jersey is another hot spot. The number wasn't updated from yesterday, though, so I have no idea how many cases are in New Jersey today. 2844 was yesterday's number. And if you take a look at these tents that are set up here, there's a really big testing area that they're setting up, but it's not for everybody. You have to be a medical professional, or you have to have some severe symptoms to get tested. So, there's still a lot of states are way behind. They don't have enough testing capacity. They probably have enough test kits, but they don't have enough people to administer the tests and to evaluate them, to test the test kits. So, and then on the right, New Jersey reports biggest single-day jump as coronavirus death toll reaches 44, 17 new deaths. And the middle picture is a 25-year-old guy who had a coronavirus test because he had the symptoms, and they lost the test. Now, I don't know how long they lost the test. I read this article. It didn't really say how long. His mother was speaking most of the time. I saw a video with her speaking too. So he's in a coma now, a drug-induced coma, to try to heal, and he's on a respirator, and they're trying to get him remdesivir, which is that miracle drug that we gave to the first victim in the United States, and that guy recovered the next day. And this is the same story we just talked about on the right with this 25-year-old in a coma. Hopefully he'll get permission to use this drug, because it is kind of a miracle drug. On the upper left, we have majority of New York COVID-19 cases are people under 50. The majority of people, testing positive. And then we have on the lower left, a few days ago, this 34-year-old person from Los Angeles or Southern Cal died from coronavirus, and that was like 2 days after he was diagnosed. And then today in Los Angeles County, first known youth coronavirus death. Some person that was younger than 18 years old, and there's no news about the person because they're under 18 years old. And, so this whole page is about youth. I mean, it's not just, a disease for old people. And then finally, the last thing we have is this $2 trillion deal was finally passed by Congress and by Trump. That's all we have. And then this is a graph that I keep up to date with the United States. You can see the cases. You can see the red dotted line I put in there. We are accelerating still. The number of cases goes up every day, but it goes up, geographically at least. It'll probably be exponentially pretty soon. It's not a linear line. We're accelerating the number of cases every day. Scary stuff. And this is the graph that I showed you under South Korea. You can see the light blue, medium blue line is Italy, and they're still up there almost, at 70,000 cases now. Keep in mind, China is only at 80,000. So Italy is going to catch China with the number of cases. And the United States is going to pass Italy. Look at the dark blue line. It's accelerating more than any other country because New York can't get it together. So that's all we have for today. Appreciate your time.